We have a very renowned surgeon from North India, Dr. Parul, please.
It's okay, the picture is popped up on its own. But what I wanted to show was if you have an elderly gentleman without glaucoma also, and if they're putting milk in a white mug, it is really difficult for them even to appreciate contrast. And if we talk about a glaucoma patient where contrast is already compromised, the job is even more difficult. So just by changing the color of the mug, you can make the life of these people easy. So that's how much relevance contrast carries in your day-to-day life. So what I really want to do in the next coming few minutes is to sensitize you about the relevance of this often ignored test, which is a relevant part of the visual function. Slides aren't moving. So yeah, so this study asked about 100 plus glaucoma patients what they actually saw. So typically we have been shown that there is a tunnel vision for glaucoma patient, and we have that picture in our books. But when the patients were asked about what they really face, they said that what they really needed was more light, and especially when they were moving either coming in from a dark room to bright light and vice versa. Real life is not as easy as viewing alphabets on a Slethen's chart where the contrast is really very pronounced. Especially at dawn and dusk, it is very difficult for patients and elderly individuals to differentiate between the curb and to look at the road ahead. So it's very important that we focus on this contrast sensitivity, especially for glaucoma patients where the disease itself is adding on to a compromised contrast in addition to the age. Several studies have already established the importance of contrast sensitivity and its decline in not only established cases of glaucoma, but also in ocular hypertension and pre-perimetric glaucoma. There are now studies coming up which are actually telling that how much dropout in the retinal nerve fiber layer thickness reduces the contrast sensitivity by a certain number of log hours. Now this may vary for patients with early, moderate or severe glaucoma, but it just makes sense to ascertain contrast sensitivity as a test and correlate it with the OCT RNFL that we are doing. Now I'll show you why this carries more relevance in severe cases. Now having established that this is something that is getting affected in glaucoma, let's have a look at the tools for contrast sensitivity assessment. Since time immemorial, we've been talking about contrast based, the chart based test, especially the Pelly-Robson chart, which actually suffers from fading over a period of time, and since there are optotypes on the chart, you need a literate patient to do that test. Now tests are coming up either on mobile based systems or computer based tests, which can actually give gratings which are not dependent upon either the literacy or fading effect. So the test that I would be talking about is the Spaeth-Richmond contrast sensitivity test. At this point of time, it is a free test based online. You just have to create your account and your patient's data is stored in the cloud. And I've been using this test now for over 5 years, and my patient's data, even the follow-up data, is saved in the cloud, and I can see how somebody has deteriorated or status quo. So basically what this test is doing is it is providing you information not just for the central quadrant, also for 4 peripheral quadrants, which no other contrast sensitivity assessment tool is providing you the information. So each quadrant carries a value of 20. Since there are 5 quadrants now, the total value is 100. So what value of sparks is suggestive of glaucoma? So the tests that have been done in the studies that have been carried out in Caucasian population have shown that any value of the total spark score less than 70 has shown to be 80% sensitive and 93% specific for glaucoma, and even glaucoma suspects have the dropped value of spark score. So that's something to really look at. In addition to doing an RNFL, we can do a contrast sensitivity testing even for our glaucoma suspects. So we did our own study to see is sparks good enough for detecting glaucoma, and we found out that it was robust and better than Pelly-Robson, both in sensitivity and specificity for detecting glaucoma in various severity stages. Now when it comes to progression, we know that especially in patients with moderate and advanced glaucoma, outer field may already be depressed and the reliability will reduce over a period of time. And with OCT, we know that there are chances of floor effect happening as the disease progresses. So in these cases, how do you ascertain that your patient is deteriorating further? Their studies have shown that contrast sensitivity can help you pick up subtle changes. Although there are no concrete values in literature at this time point to show that 10 units change in the contrast sensitivity means that there is a progression, but still there are relevant studies which have shown and which have picked up that rapid visual field progression, these patients have a significant decrease in the contrast sensitivity. So if you have a patient and you are doing the visual fields and you see that there is a progressive decline in them, you can corroborate your findings of the visual field with the contrast sensitivity test, and you would find out that you are able to detect progression at a much earlier level. Again, we in our own subset of advanced glaucoma patients, we had severe POAG patients in which we compared SPARCS with Humphrey visual fields at baseline 1 year and 2 years, and we found that SPARCS was able to detect contrast sensitivity earlier than the visual fields. So this is one of the representative cases, and this is how the outcomes look like. This is the baseline of a patient with advanced glaucoma, and you see that 2 years later there is a drop in values in almost all the 4 quadrants of this patient. Does intervention improve contrast sensitivity? Yes. So this study we gave travoprost to patients, and we saw that the contrast sensitivity parameters, both peripheral and central, improved after 3 months of giving prostaglandin treatment once the intraocular pressures were controlled. So what is the practical application of talking about an additional test which we are doing? We need to focus at visual rehabilitation of our patients also, not just giving them treatment or doing surgery, because their day-to-day vision related quality of life is very important. Highlight the better lighting to create a better contrast. If somebody is getting down the stairs, the margins of the stairs can become very difficult to appreciate, so yellow taping or red taping can be done at the margin of the stairs. You can just increase contrast. So even if somebody is wearing a watch, a white dial with black straps and black arms, and similarly for other day-to-day activities, options with specific apps on smartphones, tablets and e-readers can be done. We need to understand that visual acuity is just one element of visual function. Contrast sensitivity carries a lot of relevance, especially once the age is increasing and you have additional diseases like diabetes and glaucoma in patients with increasing age. So different contrast sensitivity tests exist. You can pick up any of your own choice, although at this point there is no clear consensus on which method is optimal, but you have now seen that even in ocular hypertensives and pre-merimetrics, there is a decline in contrast, and you can detect disease progression even in these patients before they actually develop an established form of glaucoma. So at least start checking contrast sensitivity, and if possible you can use SPARCS as a tool because it gives you additional information about the peripheral contrast sensitivity as well. Thank you so much.
Madam, apart from Spaith, which other app you're using? Actually, I have never used, very frankly. We never thought about it. Congratulations to you.
I now use SPARCS along with Pelli-Robson, because in order to show to the world that this really works, I've been doing it in a lot of other studies. I'm using this for IIH patients also to see whether there is a decline in contrast with decreasing edema. In patients who are taking hydroxychloroquines, in patients who are on isotretinoin, and even on ATT. So checking contrast with all these disorders where, basically any place where optic nerve function is getting compromised. So this really helps to pick up certain cases in time.
Any app on the Play Store available? Nothing.
This is an internet-based test on it, which you can do on a desktop. So if you use a tablet, the sizes of the tablet would vary, and on a phone the contrast itself is so variable with each device that you won't be able to get certain standardized subset of data. So it is always better to use the same computer that you're using. So any laptop or a desktop is good enough, and at this time, at this time point, this is a free test. So, and your data is safe in the cloud.
Any practical guidelines, practical tips like room lighting, distance?
Yes, so to be sitting away from a window, the tube light should be behind the screen. It should not be a totally dark room, a dim lit room with that standard parameter on every visual field testing. The patient just has to see the gratings that appear. They appear randomly either in the center or the peripheral four quadrants, and they just have to press the space bar the moment they see the screen. So that's just about it. There's nothing, even illiterate patients, even elderly patients of 80 years of age are able to do it. The gratings are prominent enough for them to be picked up. So that is one additional advantage. And this test is not prone to any fading or any other literacy related issues.
There are a lot of companies which give digital charts which have contrast testing. Do you recommend it?
Yes, no, I don't. I've tried several. Even with this, in the same day also, I've done some of the tests on my own subset of patients. There are variable responses. So even when the battery of your tablet or your laptop or your phone, it's starting to decline, the illumination of the screen changes and the outcome changes. So it has to be a fully charged system, and preferably not a phone or a small tablet. Desktops, especially for contrast sensitivity, provide robust results.
Cataract interferes?
Yes, cataract interface.
Ma'am, what are your views on yellow IOLs in respect to contrast?
I'm yet to see any change because a few of our patients who are on follow-up have received yellow IOLs, but there is no influence of, if you compare with the patient with a similar degree of disease, there is no influence of a yellow IOL or a clear IOL. But having said that, multifocals influence the contrast sensitivity. So I've not tried doing the test on patients who have had a multifocal IOL.
Ma'am, will you recommend, carry forward, advanced glaucoma, will you recommend a multifocal if a patient is insisting on a multifocal
No,
lifestyle?
I don't. I've seen unhappy patients. I don't. EDOF, yes, but not a multifocal.
Thank
At
you,
least
ma'am.
for me.